I sat down to start eating some dinner and started experiencing chest pains, shortness of breath. My hands started getting very clammy. I couldn't get full function in my hands. I started to lose feeling in my feet. Once we got to the hospital and they did the CT scan and everything like that in Sioux City and let us know what was going on, I knew that my chances were pretty slim. They don't have the medical team for this type of procedure. I was just in shock, wondering in the back of my mind, am I gonna make it? The team was all prepared and ready to go when we got here. I have 2 kids at home, so I basically made them promise me that I was coming back from this.
This is an absolute life and death emergency. Get to the operating room as soon as possible. And when he arrived here, we wasted no time. He went straight through the emergency room on and up into the operating room. About half of patients with an aortic dissection, die within the first 48 hours. The mortality rate is estimated to be at about 1 to 2% per hour. So he had a tear in the aorta, right where the aorta comes out of the heart, which is referred to as the aortic root. And that affects where the coronary arteries are, which are the blood vessels that come off and supply blood to the heart. And also the dissection had disrupted the aortic valve to where he had essentially wide open regurgitation across the aortic valve, which in and of itself is a life-threatening problem. In my opinion, his mortality from this without a surgical intervention was 100%. I think for sure he would not have survived. The way we do this operation is we have to cool the patient all the way down. We cool the body temperature way, way low, and that allows us to briefly stop the circulation. So there is no blood flow, sort of similar to stories you hear about people who've fallen in ice or in the lake in the winter or something, and their heart stops for some period of time and they can be resuscitated. And we sort of, that's simplifying a little bit, but it's a similar technique where we cool the patient all the way down, and then we stop the circulation. We briefly stop the circulation and then reconstruct that area of the aorta and then restart the circulation and warm the patient back up. And it really takes a multidisciplinary team, and that's what we've put together here, which involves cardiac surgeons, vascular surgeons, we have cardiologists, geneticists, and we strive to provide the best patient care and to be able to improve outcomes by having this multidisciplinary approach, which is what really differentiates our program. It's incredibly rewarding to have a situation like this that would be almost certainly fatal, and to be able to get them through it successfully and get it home. And we certainly celebrate these together as a team for the patients and for their families, and it's incredible to be a part of. But I would overall anticipate that he would have a really good long-term quality of life.
Care's been great all along, from downstairs when I got here, the surgeons reassuring me before they put me under. Every nurse that I had down in ICU, every nurse that I've had up here has been absolutely great. I think about, well, what if it would have been another hour, would I be here? Not many people survive this. If we wouldn't have had UNMC, I wouldn't be here. So having something, within range of where I live, I am extremely thankful for it.